Senator Jones.
Thank you, Mr. Chairman. Thank you all for being here today. I really appreciate your testimony, your consistency over the last few months. It has got to be somewhat discouraging to all of you as it is to us to see these numbers. I want to kind of focus a little bit on schools as we will start opening schools up in Alabama in August. And let me give you a little chronology here. The state of Alabama kind of began to open up its economy more in May, a little bit more toward the end of May. And then for Memorial Day, we saw the photographs and videos that Dr. Fauci referred to with everybody just having a big time from a Memorial Day holiday. Now, at the end of June, we are at our highest levels. The last 14 days have shown over 10,000 cases, which is 28% of the cases that we have seen have occurred just in the last 14 days. At the end of this week, we have the July 4th holiday coming up, and we're going to see a delay in hospitalizations from right now. If we do the same thing on July 4th, we're going to have a huge problem at the end of July and early August when we start opening schools up. Our state school superintendent this week said that it would cost about $1.8 million for the average school system to do those things necessary to try to protect kids and the faculty. But I heard Senator Paul in his comments and discussing a number of things to where you would get the impression that we could just open schools back up without spending any of that money. So my question primarily to Dr. Fauci and Dr. Redfield, could you comment on some of the statistics and some things that you heard about children transmitting this disease and whether or not we need to spend some additional monies for our schools to do things like have extra PPE, to do things like potentially hiring additional health officers, temperature screenings, those kind of things? Are those going to be necessary based on what I've heard from Senator Paul and what happened on his charts in other countries? Dr. Fauci and Dr. Redfield.
I'll quickly give it a shot and then hand it over to Dr. Redfield. We don't know precisely. I think the data that was very interesting that Senator Paul showed about school openings and not seeing any real obvious surge in cases is important, but we don't really know exactly what the efficiency of spread is. First of all, how many children get infected. That was the reason why in my opening statement I mentioned the study that we're doing at the NIH of 6,000 families looking at children. What is the rate of their infection and how often do they infect their families? Because if it's true that the rate is down, we know that they don't get seriously ill with hospitalizations when they get infected. But if the rate of infection is down and they don't readily transmit to their parents and family members, that's going to be very important in the decision-making process of opening schools. Hopefully, we're going to find that out reasonably soon by this study that we're doing. Bob?
I'd echo what Dr. Fauci said. CDC has a number of what we call household studies going on to try to get a better understanding of how does the virus get into a household, who brings it in, what happens when it's in the household, how does transmission vary depending on how the household responds in terms of social distancing, et cetera. So there is information that we are gathering. I think we don't know the impact that children have yet on the transmission cycle. So I think we should just acknowledge that. The greater threat, obviously, is, again, the children to the vulnerable, but I think one can actually have social behavior that can prevent that. So I think that would be just to emphasize. I think it's really important, as has been said already, that we move forward and work to reopening schools in a safe way. I think it's of note that CDC never really recommended closing schools. It sort of just happened, as you know. We can do targeted school closings if we have to in a particular region, like we've done for other viral diseases. But I think we really need to move forward now and work to how to reopen these schools safely.
All right. Thank you. Admiral Giroir, I want to make sure we're tuned in, and we've talked about it a little bit. Are we going to be able to make sure that we get vaccines distributed in the most vulnerable of communities, because that seems to be where so much is happening right now in the rural South? And are you making specific plans to make sure that we get that into the rural areas?
So thank you very much. So we all work on parts of this problem, right? So The CDC actually controls the distribution, but what my office does, running the National Vaccine Program, does things like the Morehouse grant, that cooperative agreement that we announced last week, that really reaches into the rural, into Hispanic, into African American, to really have the community, the people who are in that community, not only link to services like testing, but to lay the groundwork for vaccine acceptance, because we know that the burden of disease is fundamentally burdened on these individuals. So these are the people, assuming the science works out, that we want to get vaccinated first.
All right, great. Thank you. Thank you, Mr. Chairman.
Thank you, Senator Jones.